If we could turn from one innovative health financing facility to another. Lelio, UNITAID's air ticket levy is an example of an innovative financing source for development that's remained steady over time, even during the recession. Can you comment on the lessons from the air ticket levy that would be relevant for pandemic preparedness financing?
Thank you. Thank you for having me. It's a pleasure being here. Indeed, in the last 30 years, 5 industries have benefited massively from globalization: internet, mobile communications, air transport, extractive industries, and banking and finance are 5 sectors that have made a lot of money in the last 25, 30 years. The air ticket solidarity levy is a microtax applied to air transportation. It's an industry having a sustained 5% annual growth in the last 30 years, with a spectacular forecast of doubling its passengers from 3.3, more than doubling, from 3.3 billion passengers a year currently to probably close to 7 billion passengers in 2024, in the next 10 years. The air ticket levy was put in place in 2006 through an agreement between Chile, Brazil, France, UK, Norway, Korea, and other countries. It is applied in 11 countries right now, plus tied funding from other countries. For example, Brazil is not applying directly the microtax, but they calculate their contribution to UNITAID based on the number of passengers taking off from the Brazilian territory. And the air ticket levy is producing close to a little bit more than 200 million euros a year. It has collected more than 2.5 billion until now. And it's applied for funding UNITAID, our agency. We fund innovation in the response for the 3 diseases, AIDS, tuberculosis, and malaria, in a complementary manner with the Global Fund and the governments, of course, and the big bilaterals like PEPFAR and PMI from the US. And also, it is used for funding part of the operations of the Global Fund and other initiatives. But principally, it comes to UNITAID. UNITAID is currently funded. 60% of our funding comes from the air ticket levy. Lessons learned. Many, of course, but probably the most important is the fact that solidarity in general and this particular instrument is possible. It is possible. It's not a utopic NGO speech with no traction in the reality. It is something that is possible, that can be done if the political willingness is there, and can be implemented in a successful manner. It requires certainly a concerted political effort from different sectors of the governments of the countries involved, especially the executive power, who takes the decision of moving forward that, and the parliament to approve the law, because it is a law. And that is part of the beauty of the air ticket levy, because it is intangible. It doesn't get in the national budget, so it's less vulnerable to political volatility from the donor countries. It requires administrative discipline for keeping it tied to the original purpose. The temptations are often using that air ticket levy for other priorities like climate change and global warming and other Ebola or responses, emergency responses. So it is important to keep it tied to the original purpose. The potential is enormous. If the air ticket levy was applied in all the European countries, it would be producing more than $1.7 billion annually for international development, which is a considerable amount, is almost what the US has applied in the fight against the Ebola in the last 2 years. The second big lesson learned is that it brings, as Christopher was saying, the predictability, robustness to the response, and stability. And another element that I would mention in terms of predictability is the clarity for the recipient countries to bring additional funding, complementary funding. If the recipient knows how much money and when this money from the international community will come, it's easier for them to plan and to convince their political instances to apply this funding in the response. The third element, and I will quickly finish with that, is the third lesson learned, I think, is that it is just a funding source. It's not a solution per se. It's a means. It's not an objective in itself. Money in international development is not an objective. It's a means for doing things, for changing the reality. So it's not that we won the battle because we got the money. We have the money, but then we have to apply and to spend it properly. To spend it properly means not having excessive administrative costs, not having excessive bureaucracy, having transparency in the way we apply it, having flexibility, having risk appetite for making mistakes and bringing innovation in that sense, because you hit the jackpot when you take risks and you do things out of the box. I would just stand there.
That's very interesting. So this morning I was intrigued that this concept of value for money was mentioned a couple of times. And so there's clearly a role for innovative financing mechanisms in pandemic preparedness and response. And so could you comment on how we could go about evaluating the value for money of distinct proposals? And which organization do you think would be best positioned to evaluate who offers the best value for money?
It's a very difficult question, because value for money is a concept that is very much l'air du temps right now, but nobody really knows exactly what value for money means. You could say that you could talk about a return of investment from a financial point of view. You can talk about public health impact, which are different concepts and sometimes conflicting. In the case of UNITAID, the value for money is quite complex, because we operate at a third level. We bring innovation for others, saving more lives. We are the Accenture of the international development. Probably you saw the ads of Accenture in the airports. They never say what they do. They say what their clients can achieve thanks to their work. And we like that to position ourselves in that sense. For example, when we, together with Gates and USAID, made possible the introduction of the Gene Expert, which is a very sophisticated and very practical system for testing tuberculosis, getting the results in 40 minutes as opposed to 20 days before Gene Expert. When we put that in the market, the value for money of introducing that device, that technology, is enormous, but has different layers. It has one evident one, which is the time saved, which can be traduced in lives saved. But also, you could say that the time of the medical doctors spending testing people is also value for money, and the transport and the days that the mother is not losing bringing the kid to the point of care facility or the hospital is also value for money. So it's clearly there is clearly an aspect of return of investment, and according to our calculations, our portfolio has between $1 to $5 to $1 to $20 in return of investment, meaning each dollar UNITAID is investing is making the global response save between 5 and 20. And from public health, the advantages are enormous. There is another aspect of value for money, which is from the firms, the airlines. The airline industry and the tourism is the first industry affected and impacted by epidemics in general. For example, I was trying to prepare the presentation today, and Korean Airlines and Asiana Airlines canceled 230 flights due to Middle East respiratory syndrome. That is a direct effect of a pandemics, of an epidemic, is impacting the tourism and the airlines. So they also see maximize their investment in an instrument like the air ticket levy.
Well, just also the second part of the question, which organization do you think would be best positioned to assess the value for money of different proposals?
Different organizations assess value for money in very different ways. We are currently working with PIH, with Paul Farmer, and with Results for Development for calculating the value for money of our investments. DFID has very sophisticated and very good ways of assessing their value for money. It's true that the UK is really insisting in trying to translate their investments in the return in public health terms and in financial terms. That is because of political reasons. But I think DFID, together with FINE and PIH / Results for Development, are today probably the ones who have taken a step ahead. Yeah.